And so, welcome once again to Ms. Sylvia Lemus. Today, we're talking with you once again in regards to COVID-19 and the resources that the county has, what new
Mhm.
regulations the state is having for the community. Can we get started, as always, with the numbers? The numbers are not looking good. What can you tell us today?
Yes, they are not improving, Rafael. That's why we're in a situation that we're at right now. Let me share some data with you. So right now we are, I just checked, updated the numbers this morning. We now have 22,531 confirmed cases. In the last 24 hours, that's 488 cases more that have been confirmed. 488 cases. Unfortunately, we have a total of 227 cases, which includes 8 deaths from the last 24 hours. 8 people have lost their lives from COVID in the last 24 hours here in Sonoma County. And we are continuing to do the testing. We have now completed 431,204 tests in Sonoma County. 2,700 tests in the last 24 hours. So we're busy. We're continuing to do testing, but unfortunately, our cases are also increasing.
And so it's a
Um,
bad situation because if things don't get better, we're going to have to continue to stay home.
mhm.
And people are fed
Yeah.
up with staying home. People are fed up with wearing the masks. And we
Hmm.
understand that. But
Hmm.
unfortunately, part of the reason we are going through this is because some individuals still fail to understand or
Hmm.
choose to follow the rules, and
Hmm.
therefore they're visiting other people, they're getting other people sick, and it's not so much that it's ignorance anymore as much as just negligence, and that's just my point of view on this. How bad is the situation with the ICU? And the reason I asked this
Yes.
is I was talking to a doctor and she
Mhm.
was saying that at Saturn, I was just talking with her on Tuesday, and she was just saying that at Saturn, um, which is actually the one with the largest ICU, if I remember correctly, in this county, there are a lot of people who are dying there, and they tend to
Mhm.
be Latinx individuals, and many of
Mhm.
them wait and wait and wait and come in, she says, until they are having such a difficulty breathing that by the time they come in, they put the tube down
Mhm.
their throats, it's too late, and they end up passing on.
Mhm.
And as you
It's
mentioned,
too
8 people
so
passed
sad.
away just
Yeah.
yesterday. And
Yeah.
so, what are
Yeah.
the numbers like
Yeah, let me
as far
share
as the
a little bit
ICU?
more information. Yeah, a little more information. We now have 40.6 cases per 100,000 in our population, and it should be less than 7 to move to the next tier. Our testing positivity rate is at 9.1%. It should be less than 8%. Our regional ICU availability, and this is the Bay Area region, is at 4.7%, and it should be 15% for them to avoid that mandatory stay home order. Locally here in Sonoma County on Tuesday, we were at 6.9% ICU capacity. So we're very low. We have to get to 15%, and we're at 6.9%. So we have a long ways to go and a lot of work to do.
And so the governor again says, you know, we have to stay home. What can you tell us
Mm-hmm.
about what the governor is saying
Mm-hmm.
to the community about having to stay home?
Yeah, so initially the first day home order was going through the 9th of January, but since things didn't change, it was extended. So now it's on a 4-week review. So in 4 weeks, they're going to review and see where we're at. But so we're all in the whole region in the stay home order. So the way it's affecting us is that, it has a lot of effects on us a lot of the businesses are affected. I don't know if you're going to go into some of the businesses that are affected under the stay home order, because we have stay home order that we shouldn't be leaving our homes unless it's to work, essential work, or because you have to go to buy food or go to the doctor or medical. Those are the only reasons we should be leaving home, only for essential travel outside of our home. Or even if you want to go to the park and walk, that's okay because it's for your health. It's a part of your health care is going to the park and going on a walk. But you still have to do everything with safety. Using your mask, keeping away from other people, not not being together with other people that don't live with you, and wear a mask and keep your distance. So that's very important. Um,
Definitely. Yeah.
and the businesses have been affected. So the stay home order, um, it allows 20% capacity at retail operations, so they can only allow 20%, and grocery stores can only allow 35% capacity. So some of the stores, if you notice, have metered entrance now, where they kind of like watch how many people go into the stores. I know that Oliver's here nearby where I live, they always check how many people are in the store, and they have people at the front and at the exit making sure that they have the right amount of people in the stores. Churches are only allowed to have outside services right now. Um, and there's some services like, for example, restaurants have been most affected, I think, a lot of restaurants, because they can only offer takeout, pickup, delivery only. They can have people there even if it's eating outdoors. But the following businesses do have to close: hair salons, barbershops, personal care services, movie theaters, except for drive-ins, wineries, bars, breweries, distilleries, except for the manufacturing or distribution, production, um, family entertainment centers, museums, zoos, live audience sports, amusement parks. All that has to be closed down. So like Disneyland and all the parks that we have here to take our families, everything is closed right now. But outdoor activities are allowed only for health reasons. Like I said, still has to be physically distanced, using all the safety, but like the parks and things like that. I have seen some gyms that are outdoor operations that they're allowing, but I think that there's a lot of rules around that as well.
Mhm. Yeah, definitely, especially about social distancing. And what can you
Mm-hmm.
tell us about any changes that have been made in regards to testing?
With the testing, we're doing still continue to increase our testing opportunities and options. We at the county are going to go back to doing the county pop-up sites at all the different kind of targeted neighborhoods around the county. Starting with this weekend, we're going to be doing testing at Andes Unity Park, starting this weekend. But we have, for example, OptumServe that runs sites in Windsor, Petaluma, Santa Rosa. So we have some state collaborations, and also there's some private testing. Curative is a private testing that the county's not involved with, but they also have sites in Roanoke Park, Santa Rosa, Sonoma. And if you go to socoemergency.org, our website, there's a calendar on there that has all the different sites and testing and where you can get tested with phone numbers. Because some of them you need to go online and schedule a test, but for some of them you can call the county and schedule a test. And it's still the same number for the county. It's 565-4667 for the county. But like I said, we're still increasing testing throughout the county, and we still encourage everyone to get tested. If you have symptoms or you don't have symptoms, still get tested.
And so it's important again that people understand there's all of these services in regards to testing. And one of the things I do recommend to people is if a family came out positive recently, let's say today you found out that the family member came out positive for COVID,
Mm-hmm.
I personally tend to tell people to not call and schedule an appointment for 3 to 5 days, which is
Mm-hmm.
what sometimes happens, but just show
Mm-hmm.
up to one of these pop up testing centers and say politely, I'm here because a family member tested positive and I really
Mm-hmm.
just need to know because maybe I have to work and I need to make sure
Mm-hmm.
that I don't take the virus to my job. And
Yeah.
most likely, what's happening most often than not, they get tested that same day at
Mm-hmm.
that same location. I think that
Yeah.
they specifically do it where they have a few extra tests so that
Mm-hmm.
then they can do that testing for those individuals who show up
Mm-hmm.
on the day and the time that they are offering
Yeah.
that testing. So that's really, really important. And that brings us to, again, we're having all these cases, but there's a little bit of hope for sure with the
Mm-hmm.
vaccine. And so we had the Pfizer vaccine when it first became available for Sonoma County. I think that you reported something like 4,700, 4,800 that had been
Mm-hmm.
sent to Kaiser and these other places, and the
Mm-hmm.
county had kept some. But by now, how is that going?
Mm-hmm.
Is it going smoothly? Are we having a lot of glitches? What can you
Mm-hmm.
tell us about it?
Yes, well, like you said, we started mid-December, like mid to late December. We started doing the vaccines, and as of this week, so far, we've tested 14,374 people total. So that's a lot of people that have been tested. We are ramping up our vaccination distribution. We're preparing to do mass vaccine clinics. And so right now we're securing locations throughout the county. We're looking at the Grace Pavilion at the fairgrounds. We're at the gym in Windsor, Petaluma JC in their gym. They have a gym there. So we're securing places throughout the county so we can have mass vaccination. And one of the things there is we have a really great site on SoCo Emergency, socoemergency.org/vaccine. There's a lot of charts and tables and information about the phases and the tiers. And there's even a really great graph that shows you what level we're at. and what phase and tier we're at. So you can see that. And it's approximate and it changes and it's fluid. And the reason I say that is because a lot of it is supply and demand. Everyone wants a vaccine, but we are dependent on state and federal on the vaccines that we get. So we don't know, and we can't guarantee how many we're getting, so that we can't really give you more approximate dates of when we'll get to all the different levels and tiers, for that reason. And in addition to that, we're asking the state for resources to help us to administer the vaccine, because we also need to have staff. And I know all the hospital and clinic staff are really busy dealing with the existing COVID cases and the existing vaccines, that we need additional support from the state to administer, as well as volunteers, people that are licensed. We did get approval recently, I forgot to mention earlier, that EMTs and dentists are now approved to give vaccines, to COVID vaccines. So we're trying to look at different ways that we can kind of increase our personnel to help give vaccines, because we want to, vaccinate everyone. So, we have the Safeway. Safeway is going to be helping us too. So their pharmacists are starting this week. They started with IHSS workers, who they're on and eventually they're going to do general population. So people can go online to Safeway. They have a website. They can go make an appointment, but not until they're eligible, not until we get to their level, until their phase and tier level, which people can get that information on socoemergency.org/vaccine. There's really good information on there.
Definitely. And again, it's that's where we're going to have to go, which is many different private companies, and then people who have, the regular health provider, whether it is Kaiser or, they should communicate directly with their healthcare provider if they have one, to try and get more information about when their priority is going to be.
And I do have a lot of information. So your first person is your primary care provider, and then check with them first. And then if your workplace is high risk, then we might be working with public health to kind of set up some sort of testing. If you don't have a health provider, then check at socoemergency.org vaccine, and there'll be information on there. Or you can also call 211. Because we're giving that information to 211 so they can have it, the information that we're giving and whatever's on our website, so they can also give the information to people that call. And that's in Spanish and English, in any language too.
And one of the things that you did mention earlier in regards to February, if I understood correctly, farm workers may actually become some of the people to get the vaccine in the next month, because they, to a certain, not to a certain degree, they are in fact essential workers. They keep the food and, for Sonoma County, a lot of other products coming out from milk and so on and so forth. What can you tell us about?
Yes, they are on that level. Let me just pull up that information right there. But they are on there to receive, and it looks like around February. But again, the timelines are flexible and fluid because it depends on the supply that we get of vaccines, and there's a supply and demand, But they are, and we are anticipating that in February that farm workers will receive their vaccine.
Good.
And we have a lot of groups that are working on just making sure that it's equitable. And our farm workers, like you said, they put the food on the table, so it's equitable that they have their place in line.
Definitely. And then the next item that I had a question on here, it has to do with what is it called? Travel. And what does the governor say in regards to traveling either within California or outside California? And what should people do when they return, especially if they travel abroad? As we have mentioned in Spanish, starting on the 26th of January, the United States government is saying that they're going to require people to have proof that they had gotten tested in the last 36 hours and that they tested negative before getting on an airplane or before arriving to the United States. But what about California? What can you tell us?
Yes, in January 6th, the governor ordered some new travel advisory, advising people to postpone their travel plans and not to travel. So they said non-essential travel, don't do it. Unless it's connected with something essential, you shouldn't be traveling. And they should have, California should avoid non-essential travel of more than 120 miles from your home. From your place of residence. So that's what they're recommending, is to avoid travel because we risk transmission. And especially, we know other counties like LA County, their cases are really bad right now, and their infection rates are really high, and so we don't want to kind of help spread the virus among the state. There's some areas that have less virus transmission, other ones are higher. So they're limited to 120 miles from your home, and don't travel. And if you do travel out of state or out of the country, and you come back home, you need to quarantine for 10 days. That's what they one of the recommendations that the travel advisory issued. So so you have to quarantine for 10 days after you arrive if you do go out of state or out of country.
And again,
So that's a big
you
difference.
yeah, and if you come back from out of state or a country, you should definitely get yourself tested and then go back
Mm-hmm.
home and stay home and
Yeah.
wait for the result. The idea here is that it does take 10 days usually for people, most people,
Mm-hmm.
to see some of the symptoms of the COVID virus. And so it's really, really essential. And that brings us to risk categories. We know for sure
Mm-hmm.
that asthma, people who has suffered from asthma, again, we were talking with a doctor recently, and one of the things that she was saying is in the fall, many asthma sufferers, we
Mm-hmm.
tend to take a special medication to make sure that our lungs are clean and clear. And because there's going to be pollen, people are going to start, burning firewood to stay warm at home. All of those different things that affect our lungs, and a lot of people, either their medication runs out and they don't go and refill it, or they don't have the money, they don't have insurance, whatever the situation is. So people with
Mm-hmm.
asthma are definitely a high
Yeah.
risk for COVID that can lead to
Mm-hmm.
death. What other groups
Yes.
are at risk, at most risk?
Yeah. Yes, Rafa. So people with chronic conditions are really high risk for becoming ill. Older adults we know, and people who have chronic conditions like high blood pressure, obesity, heart or lung disease, diabetes, asthma, those people are all high risk of being very ill or even dying from COVID-19. So if you have one of these risk factors, you have to really take extra precautions to protect yourself from COVID. Like I said, obesity, asthma, lung disease, chronic kidney disease, high blood pressure, heart disease, diabetes. Even if you're a smoker, we know that COVID affects the lungs. So if you're a smoker, you put yourself that much more at risk. You need to kind of take better care of yourself, and be in contact with your doctor and keep routine medical appointments, or just keep yourself safe and away from other people. You have to be extra careful.
And just to clarify, when Sylvia mentioned smoking, I'm sure you're also including people who smoke marijuana on a regular basis, because again, the idea here is inhaling, and the smoke
Hmm.
eventually will damage your lungs. And finally, I know I've taken a lot of time from your day, but I
That's
think
fine.
that once in a while, when we have the time here in the
Yeah.
show and you have the time, we need to educate our community as much as possible. One
Hmm.
of the concerns sometimes that people have is when they
Hmm.
contact somebody, when what is called contact tracers, as they call them, contact somebody and say, "Hey, we just want to know, how did you get the virus? We want to figure out, was it at work? Was it at a party?" And people sometimes lie the first a couple of times because they don't
Hmm.
want somebody to know that it was
Hmm.
because of a party, when all you're trying to do at this moment is just trying to make sure that other people don't get infected. Is
Hmm.
the information that is being gathered protected, or is it going to find its way
Yes.
out there somewhere later on?
Rafa, I want you to know that I meet personally with some of the contact tracers through work, and they're the most caring, humble individuals that care so much for the community. They doing it for the right reason, I feel, from the heart. And we want all Sonoma County residents to know that all their personal information is protected and that everyone can receive services at the county sites, regardless of their immigration status. We protect everyone and we serve everybody. The Department of Health Services is going to keep your information strictly confidential and it's not going to share your status with any other agency. And you can be assured for the following reasons. We have strict compliance with health information privacy rules like HIPAA laws, which require us to keep all the information confidential. All the sensitive patient information has to be kept confidential. And all county employees also have to sign confidentiality agreements, which further guarantees that no personal information is shared with any outside agency. Sonoma County has robust processes and systems in place for securing and storing this confidential information. You will never be asked for your social security number, for immigration status, or any other payment information. So everything is very protected, very safe, and we do everything we can because our only reason for really getting this information is to stop the spread and do what we can to kind of identify cases and stop the spread and notify people.
Definitely. And just to finish this interview, if you can give us that 1-833 phone number for people who
Mhm.
need to report businesses that are not following the rules, maybe individuals who are not following the rules, specifically people who maybe have traveled to Mexico or some other places during the holidays and are coming back and are refusing to stay home for those 10 days and are saying, I'm not going to follow the rules. I wasn't exposed. And to a certain degree, they're lying to themselves because it
Mm-hmm.
could have been, you may have stayed with your family
Mm-hmm.
in your village, in your city, wherever you are in Mexico, for example, El Salvador, Nicaragua, whatever it is. But then it was in the airplane where you touch a surface and got infected, and now you brought it back. What is
Mm-hmm.
that phone number, if you can give it to us a
Mm-hmm.
few times? That way people have time to write
Yes.
it down.
So yes, the county has a non-compliance number that people can call. It's 24/7, and that number is 1-833-723-3707. So if no one answers during regular business hours, you can leave a message, or overnight hours, leave a message. And people are reviewing those complaints and the calls that come in, and they decide kind of where to refer those phone calls. But yes, the non-compliance number again is 1-833-723-3707.
And with that, I want to thank you as always. I know you gave us about an hour of your life in
Mm.
doing this update, but again, I appreciate it because the more people have the knowledge later on, they cannot say, I didn't know. We're trying to
Mhm.
share this information with everybody. Thank you once
Yes,
again to Ms.
you're
Sylvia
welcome.
Lemus for taking the time, and I look forward to our
Thank you.
next conversation.
Okay,
Take
thank
care.
you. Bye-bye.